Bismillahirrahmanirrahim. Today we will talk about female genital system anatomy. We will discuss some internal genitalia and external genitalia. Here you can see uterus. We will talk about parts of the uterus, fallopian tube, ovary, vagina and all these things. And we will talk about external genitalia also. If we really start our class, in female we have external genitalia and internal genitalia as we have discussed in male part. So external genitalia also called vulva. It is also called pudendum. These parts or the structures which includes external genitalia are mons pubis, labia majora, labia minora, clitoris and greater vestibular glands. And the structure which comes under the category of internal genitalia of the female are vagina, uterus, uterine tube or fallopian tube and ovaries. Okay, let's discuss some external genitalia first, starting from the vulva. As you know, external genitalia of the female is also called vulva or pudendum. Okay, vulva, first of all, mons pubis. What is mons pubis? This is the rounded eminence in front of the pubic symphysis. Oh, now you can see over here, this is pubic symphysis, the joint between two pubic bone. This is called pubic symphysis. So in front of pubic symphysis we have a round eminence, and in spite of round eminence, it is accumulation for the subcutaneous fat. Subcutaneous fat is present in this round eminence and it is covered by pubic hairs in females obviously, and it acts as a cushion. It acts as a cushion during sexual intercourse. So this is mons pubis, a part of external genitalia of the female, a round eminence present in front of the pubic symphysis, accumulated of subcutaneous fat and act as a cushion during sexual intercourse, and it is covered by pubic hairs in females. Cushion is just like a pillow, takiya. So second part is labia majora. Labia means lips, majora means major means big. Okay, labia majora is a thick skin fold enclosing fat, and the counterpart of labia majora in males is scrotum. And the labia majora forms the lateral boundary of the pudendal cleft. Pudendal cleft, it is the opening between two labia majoras. Okay, and labia majora joins anteriorly and making anterior commissure. Okay, you can see over here, this is anterior commissure, and here we have posterior commissure. Labia majora, this is the labia majora. This one is labia majora. So labia majora join anteriorly and makes anterior commissure, and labia majora joins posteriorly and makes posterior commissure. And if I really talk about this diagram, you can see this is the labia majora, labia minora, and this is the prepuce of clitoris. This is the glans of clitoris. What is clitoris? It is a male, the counterpart of clitoris and male is penis. So you can say it is female penis. This is the prepuce of the clitoris, this is the glans of clitoris, this is the urethral opening, and distance between urethral opening and clitoris is 2.5 centimeter. And then we have vaginal orifice, and around the vaginal orifice we have opening for the greater vestibular glands, you can see over here. And here we have posterior commissure, and in between the posterior commissure, you can say gynecological perineum and anal canal, the distance is also 2.5 centimeter. And the rest of the things we will discuss in detail. This is the mons pubis we have discussed, and this is the natal cleft, or you can say the cleft which divides right and left gluteal region. And here we have anus, this is the gynecological perineum, and this red dotted quadrilateral part is called perineum. And here is the opening of the greater vestibular gland. This is the vestibule, vaginal orifice, and this is the vestibule of vagina. This one is vestibule of vagina. Okay, let's discuss something else. Labia majora, the outer surface of the labia majora, it contains hair follicles, and inner surface of the labia majora contains sebaceous gland and apocrine glands. These things you must not forget. Inner surface of the labia majora contains glands, sebaceous glands and apocrine glands, and outer surface of the labia majora contains hair follicles. Okay, then we have labia minora also. It is also a two skin fold hairless part. Labia majora having hair follicles, but labia minora, it is lack of hairs. Okay, and anteriorly labia minora, it continues with the frenulum of the clitoris, just like we have talked about frenulum of the penis. And posteriorly labia minora continues with the foresheet. What is foresheet? This is the skin fold present posterior to the labia minora. Okay, labia minora lies within the pudendal cleft. What is pudendal cleft? The opening between labia majora is called pudendal cleft. Okay, after the labia minora, let's discuss very important structure, clitoris. It is also called female penis. The counterpart of male penis is in female is clitoris, and it is less than 2 centimeter in length, and it is an erectile tissue. Okay, if I ask you, do you know erectile tissue in men? That is glans penis, always erectile in nature. But penis may or may not be erectile, it depends upon the circumstances, sympathetic or parasympathetic nervous system. And anterior margin of the clitoris is margin at the vestibule of vagina. Or you can say this is the vestibule of vagina, and interior to the vestibule we have clitoris, prepuce and glans penis of the clitoris. Prepuce of clitoris and glans of the clitoris. And it is the counterpart of the male penis, and but there is only one difference, that in penis we have urethra, but in clitoris we don't have urethra. And this is the continuation of, or you can say there is a presence of 2 corpora cavernosa, but there is absence of corpus spongiosum. We have discussed in detail that penis it is made up of 2 corpora cavernosa dorsolaterally and 1 corpus spongiosum ventrally, but in clitoris we have 2 corpora cavernosa, but we don't have corpus spongiosum. And clitoris, it is richly innervated by sensory receptors. Enormous amount of sensory receptors are present over the clitoris. That is why the function of clitoris is initiate and intensify the sexual pleasure in female. Obviously clitoris is present in females, so sexual pleasure initiates or intensify due to the stimulation of the clitoris, due to the presence of enormous amount of sensory receptors over here. Okay, the next part is vaginal vestibule. Vaginal vestibule, it is elliptical space between labium minora. You can see over here. Here we have labium minora. So in between the labium minora, this part. Okay, if I remove everything, this part, this elliptical space between 2 labium minora is called vestibule of vagina, and anteriorly we have a presence of urethral orifice. Here we have talked about interior to the vestibule of vagina we have urethral orifice, and posterior to the vaginal vestibule we have introitus or vaginal orifice. Anteriorly urethral orifice and posteriorly vaginal orifice. So that was about external genitalia of the female. Let's discuss about vagina, the internal genitalia of female. It is an excretory duct. Okay, excretory duct, obviously in the menstrual period, when the female is going through a menses or menstrual period, it acts as an excretory duct for the blood discharge. Then it acts as a birth canal during childbirth, during delivery, and it is a female organ of copulation. Can I know what is the male organ of copulation? Penis or whatever you want to say. But female organ of copulation or female organ of sexual interactions, sexual intercourse, that is vagina, and the length of the vagina is 3 inches or 8 centimeter in length normally. And it is formed by the non-catenized stratified squamous epithelium. Very important, non-catenized stratified squamous epithelium. And vagina is present between vulva and uterus. Vulva, it is an external female genitalia. All the labia majora, labia minora, clitoris, vestibule, and uterus, this is the internal genitalia. So in between the uterus and vulva there is a presence of vagina, 8 centimeter long, having a non-catenized stratified squamous epithelium, and due to the presence of doderline bacilli in the vagina, that bacilli will convert glycogen into lactic acid in the exfoliated cells. In the exfoliated cells, doderline bacilli present in the vagina, this is, okay, we have vagina over here, right? This is the doderline bacilli, which will convert the glycogen into lactic acid. Due to the increased production of the lactic acid, the vaginal pH is acidic in nature, more specifically 3 to 4. This is the pH of vagina. And we have discussed the pH of semen, that is alkaline in nature due to the secretions of the seminal vesicles, that is 7.5. that is alkaline in nature. So you can see over here 7.5, this is the pH of semen, that is alkaline. 3 to 4 pH, this is the pH of vagina, that is acidic. So due to this alkaline semen entry into the acidic vagina, sperm gets pH almost 6 to 6.5. that is the best pH for the sperm to be active, to be motile, to work at its best. So this is the law of nature. Okay, other than these things, the upper half of the vagina lies above the pelvic floor and lower half of the vagina lies within the perineum. And what is perineum? You can see over here this dotted space. This is perineum or perineal body. And there are 4 regions or 4 fornixes in the vagina, one anterior, one posterior, one right lateral and one left lateral. These are the 4 regions of the vagina. Okay, let's discuss very important feature, hymen. What is hymen? In virgin females, female who don't have sexual intercourse right now possesses a thin mucosal fold, very thin, delicate mucosal fold perforated at its center. And it is very important to examine the hymen to confirm the virginity of the female. It is very important medico-legally. And after childbirth, usually the hymen consists of only of tags, that is called caruncles. So after childbirth, or you can say after sexual intercourse, most probably the hymen breaks down and the thin mucosal fold that almost covering the or closing the vagina, in spite of that central hole, it converts into tags called caruncles. So that was about hymen. I can show you over here. This is the non-catenized stratified squamous epithelium of the vagina, and this is the mucosal fold of the vagina here and here, that is making hymen. This is the hymen, and due to sexual intercourse or during the childbirth, this hymen breaks down. Obviously, then this hymen converts into a tags only tags, that is called caruncles. So the medico-legally very important to examine the virginity of the female. Okay, let's discuss further on vestibule of vagina. Okay, vestibule of the vagina, it's discussed already, and above we have discussed. Here you can see there is a vestibule of vagina, vaginal vestibule, elliptical space between the 2 labium minoras, anteriorly present urethral orifice, posteriorly vaginal orifice or introitus. Plus this vestibule of vagina contains greater vestibular glands of Bartholin's, which is present between labium minora and hymen. You can see here we have labium minora and here we have hymen also. Okay, labium minora is here and hymen should be here. Bartholin's gland. Then it also contains the lesser vestibular gland opening, and it also contains paraurethral gland of Skenes. We have discussed these things in detail. So if we talk about the topography of vagina, the relationship of vagina, what is present anterior, posterior, lateral, superior or floor of the vagina. Anteriorly, the upper half of the vagina, there is a presence of urinary bladder, base of the urinary bladder. Posteriorly, anterior lower half of the vagina contains urethra and pubic symphysis. And posterior to the vagina, upper 1/3, middle 1/3 and lower 1/3. Upper 1/3 posteriorly, there is a presence of recto-uterine pouch, rectum and uterus. Recto-uterine pouch present between the rectum and the uterus. Then middle 1/3 posteriorly, there is a presence of ampulla of rectum. And lower 1/3 of vagina posteriorly, there is a presence of perineal body. That was about anterior and posterior. What is present lateral to the vagina? Upper part of the lateral to the vagina, we have ureters. Middle part of lateral to vagina, we have levator animuscles, and lower part lateral to vagina, we have vestibule and urogenital diaphragm. And superior to the vagina, we have cervix, which is the part of the uterus, or you can say the most fixed part of the uterus is called cervix. We will discuss about cervix over here when we will be talking about uterus. So that was about something related to the vagina. Let's discuss some clinical features. Per vaginal digital examination, right? We do PR, per rectal examination, when we discussed male genital system. In female genital system, the examination of the vagina, that is called per vaginal digital. Digital means digits with our fingers, obviously. So per vaginal digital examination used to be done during urinary bladder being empty. So ask the patient not to eat, or you can not to drink anything, or to go to toilet for having a empty urinary bladder to have per vaginal digital examination. Then we have vaginal laceration, which condition in which vagina becomes tear down or damaged or lacerated. Number one condition is forceful coitus. That is called forceful coitus or rape. What is rape, by the way? This is the forceful penetration of penis into vagina. Forceful. So forceful penetration of penis into vagina, it is called rape or forceful coitus. That is punishable crime. In Pakistan, we will discuss these things in forensic medicine. In Pakistan, the punishment of the rape is almost life imprisonment or death sentence. In India, the punishment for the rape is 7 to 10 years of imprisonment, or maybe lifetime. So we will discuss in detail about this punishment crime, what are the duration and what are the consequences of that. So number one condition which will lead to the vaginal laceration or damage, that is forceful coitus or rape. Number second is childbirth. During childbirth also there is a probability that vagina being lacerated. And number third is any accident. So any accident or childbirth or forceful coitus or vagina will lead to the vaginal laceration, which will eventually end up in profuse bleeding or very severe bleeding. Then another we have vaginitis, inflammation of the vagina. Most common cause of vaginitis in female okay, most common in and before puberty. Vaginitis is most common before puberty and after menopause, because due to the delicate versus resistant squamous epithelium. The vagina, it is very, this epithelium of the vagina is very delicate during before puberty and after menopause, and it is very resistant after puberty and before menopause. So due to the delicacy of epithelium of the vagina before puberty or after menopause. Before puberty means before 12 years, after menopause means after 51 years of age. So there is a chances of infection of trichomonas infection, gonococcal infection, or monilial infection. Monilial. So due to these three infection which will cause vaginitis, there will be a feature called leukorrhea. Whitish discharge from the vagina, that is called leukorrhea, happens due to these three infections. And then we have epiostomy. What is epiostomy? In Urdu, in Pakistan, we call it chota operation. Epiostomy, the incision at the posterolateral vaginal wall. Posterolateral vaginal wall, there is an incision. We usually do this epiostomy, posterolateral vaginal wall incision during second stage of labor, to increase the size of the outlet. And last but not the least, we have vaginal prolapse, interior wall. If there is a vaginal prolapse, interior wall, that is called cystocele or ureterocele, and if there is a vaginal prolapse of the posterior wall, that is called rectocele. So that was about vagina. Okay, before I really start our uterus, this is the thing I thought I will not forget. This is the uterus we will discuss now. Fallopian tube we will discuss, ovary we will discuss. So that is vagina we have discussed. The length of the vagina is almost 8 centimeter or 3 inches, and this is the hymen, mucosal fold which try to close the vaginal vault, but there is a central orifice, perforated part, due to the passage of menstrual fluid. Okay, let's discuss this part, uterus now. Uterus, it is also called womb, or it is also called hystera. Hysterectomy we do. Hysterectomy, operation of the uterus, right? So uterus is also called womb or uterus. The weight of the uterus is 30 to 40 gram in adults, and it is a female childbearing organ. In which this is the organ where the female bear her baby. And the size of the uterus is 8 multiply 5 multiply 3. It means 8 centimeter long, 5 centimeter wide, and 3 centimeter thick. And if we talk about the position of the uterus, it is anteversion and anteflexion. What does it mean? Anteflexion, this is the position, the angle between long axis of cervix and vagina. Okay, if I can show you the long axis of cervix, this is the cervix, the long axis of cervix and vagina, that is called anteversion. And what is anteflexion? Angle between long axis of cervix and uterus. That is called anteflexion. So anteversion, anteflexion. Anteversion, angle between long axis of cervix and vagina, that is 90 degree. And anteflexion, this is the angle between long axis of cervix and uterus, that is 120 to 130 degree. The parts of the uterus. Number one is cornu of the uterus, the point of fusion between body and uterine tube. Okay, if I can show you. Okay, here I will tell you. Point of fusion between body and uterine. This is the uterine tube, right? Now we are talking about the parts of the uterus. Number one is cornu of the uterus, point of fusion of the body. This is the body of the uterus, and fallopian tube. So here we have cornu. These are the cornu of the uterus. Second one is isthmus, the junction between cervix and the body. This is the cervix, and here we have body. So this part is called isthmus. And then we have body. It forms the upper two-thirds of the vagina, of the uterus. This is the body, upper two-thirds of the uterus. Then we have fundus. It is present above the entrance of the uterine tube, and posterior wall is most common site for implantation of the fertilized ovum. You can see this is the fundus, right? This one is the fundus. So it is present, this is the opening of the uterine tube. So that is present above to the opening of the fallopian tube. That is called fundus. This is the fundus. And the posterior wall of the fundus is most common site for the implantation of the fertilized ovum. Okay. Then after the, okay, let's discuss some topography of the uterus. Anterior to the uterus we have utero-vesicular pouch or superior surface of the urinary bladder. Posterior to that we have recto-uterine pouch, a pouch between rectum and uterus. That is called pouch of Douglas. Pouch of Douglas with coils of sigmoid colon and ileum. Then lateral to that we have broad ligament and uterine artery and veins. Then fifth one we have cervix of the uterus. Here we have cervix, fifth part of the uterus, and it forms the lower one-third of the uterus, and it is also having two parts, upper and lower part. Upper part is also called supravaginal part, and lower part is called vaginal part. The upper part is called supravaginal part and lower part is called vaginal part. And there are three parts actually. Okay, if I can show you, this is the cervix. Here we have internal os, then cavity, then external os. Internal os, cavity and external os is present at the level of ischial spine. If I can show you, where is the ischial spine? This one. Here we have ischial spine. So this is the level of the external os of the cervix. Cavity and internal os and external os. External os is present at the level of the ischial spine. So there are few ligaments which are required to maintain the integrity and position of the uterus. Number one is transverse cervical ligament. This is the most important ligament of the uterus that is required to hold the uterus at its position. Transverse cervical ligament. Then we have round ligament present at the lateral angle of the uterus. And then we have broad ligament. It is a double fold of peritoneum, broad ligament, and it will attach the uterus with the lateral pelvic wall. If I can show you, this is the broad ligament. Lateral wall of the uterus with the pelvic wall. Then we have ligament of ovary. We will discuss. Round ligament, and then we have suspensory ligament over here. This is the suspensory ligament, the round ligament of ovary. Then we have broad ligament. Some clinical feature related with the uterus. Uteral prolapse, obviously along with the vagina. So uteral prolapse happens during the childbirth or due to the poor muscular tone. Poor muscular tone or childbirth will lead to the damage of following things. Uterus supposed to be prolapsed now, maybe due to childbirth or maybe due to poor muscular tone. There will be damage to the levator animuscle, as I told you, that will make the floor of the pelvic cavity. There will be damage to the transverse cervical ligament, damage to the pubis cervical ligament, and damage to the sacrocervical ligament. So these four parts, when these are damaged, then there will be prolapse, outward bulging of the uterus from the vagina. So uterus and vagina will also prolapse outside of the body. Then we have hysterectomy. you know what we do when the patient is having C-section many times, or there are some tumor of the uterus, then we are supposed to remove the uterus from the body. That is called hysterectomy. So during hysterectomy, we not only ligate the vaginal artery, but we can also ligate the ureter due to the close proximity, close relationship of vaginal artery and ureter. That is called water under the bridge, because at the lateral side of the vagina, vaginal artery crosses the ureter superiorly. So while hysterectomy, while removing the uterus and while we are ligating cutting the vaginal artery, we accidentally can cut the ureters also. So this is the most common complication of hysterectomy. And CA of the cervix, or you can say cancer of the cervix, if there is a cancer of the cervix happen, then metastasis, spread of the cancer from the cervix will go through the lymphatics, through the lymph. First of all, it will infect the pelvic lymph nodes, then it will infect the pre-aortic lymph nodes, and then para-aortic lymph nodes. Now lastly, let's discuss about ovaries now. These are the female gonads. What are the male gonads? Testes. So counterpart of the testes in female are ovaries, and these are smaller than testes. Smaller than testes. They are in puberty, or before, you can say in adulthood and puberty, the color of the ovary is grayish pink, but after puberty, or you can say during menopause, the color of the ovary becomes pink to gray, and it is an intraperitoneal organ. It lies in the ovarian fossa of the Valdair on the left, on the lateral pelvic wall. This is the location of the ovary in the ovarian fossa of the Valdair, which is present on the lateral pelvic wall. Valdair, it is a name, a scientist, you can say. If we talk about this circumference, size of the ovary, 4 by 2 by 1. It means 4 centimeter long, 2 centimeter wide, 1 centimeter thick. Outer part is cortex, inner part is medulla. In nulliparous and multiparous. Nulliparous means a female who never being pregnant in her life. Nulliparous. And multiparous who becomes pregnant multiple times. So nulliparous females, the location or the shape of the ovary is vertical, but in multiparous the shape of the ovary is horizontal. If I can show you over here, in nulliparous the ovary will be like this, vertical. We have upper pole and lower pole, but in the multiparous the shape of the ovary should be like this. It is horizontal. Here we have upper lobe, and here we have upper pole, and here we have lower pole. So this is the difference between nulliparous and multiparous females. Are you with me?
Yes, sir.
Okay. After this, let's discuss some relationship of the ovary now. We are talking about ovary now. Anterior to ovary we have external iliac vessels, posterior to ovary we have internal iliac vessels, inferior to ovary we have uterine tube, and floor of the ovary we have obturator, artery, vein and nerve. Let's discuss three important ligaments. Meso-Ovarian ligament of ovary. It connects posterior layer of broad ligament with the anterior border of the ovary. Then we have suspensory ligament. It connects lateral border of broad ligament with the anterior border of ovary, and it contains ovarian artery, veins and nerves. This is very important, suspensory ligament. Okay, and suspensory ligament connects lateral border of the broad ligament plus the, okay, you can say this is suspensory ligament, right? Lateral border of broad ligament, or you can say the lateral border of ovary, and here also this is suspensory ligament. It also contains ovarian arteries, veins and nerves. So whenever we will having a female having ovarian pain, then you supposed to transect the suspensory ligament in order to relieve the pain. We will discuss later on. Then we have last ligament of ovary. Lower pole of it connects lower pole of ovary to the lateral angle of the uterus. Lower pole of the ovary to the lateral angle of the uterus. That is called ligament of ovary. Then we have covering of the ovary, tunica albuginea. It is covering a thin fibrous capsule which surrounds the ovary. Then also we have externally the ovary is covered by peritoneum. It is called germinal epithelium. Then what is the function of the ovary? Obviously ovocyte production, egg production. This is the function of the ovary, as well as estrogen and progesterone production. This is also function of ovary, and ovary kept in position by broad ligament. Broad ligament, you know, keep this ovary in erect position, its normal position. But during the childbirth, there will be laxity or relaxability or flexibility or lackness or weakness of the broad ligament. Due to this weak bond of broad ligament, which is unable to hold the ovary in its normal position, ovary becomes, you can see over here, the ovary, due to the laxity of the broad ligament, ovary goes to the pouch of Douglas pouch, recto-uterine pouch. This is present posterior to the uterus. So due to the position of ovary, location of the ovary into the pouch of Douglas, there is very unusual sensation during sexual intercourse, or in sometimes there is painful sexual intercourse. That is called dyspareunia. It is called dyspareunia, painful sexual intercourse due to the abnormal, you can say, the location of ovary that is normally present being at the normal position due to the broad ligament, but due to childbirth or due to some other factors, whenever there is broad ligament becomes very loose to the ovary goes to the pouch of Douglas, recto-uterine pouch, and due to the location of the ovary at that part, that is very uncomfortable situation or feelings during sexual intercourse, or if there is painful sexual intercourse, that is called dyspareunia. And pain of the ovary, that is referred to the para-umbilical due to the T10, and pain of the ovary can be referred to the medial thigh due to the obturator nerve. And the pain of the ovary can be relieved by the suspensory ligament transection. As we know, the suspensory ligament contain ovarian artery, veins and nerves. Let's discuss our last topic, that is uterine tube or fallopian tube. Uterine tube, that is 10 centimeter in length. Here we have, this is the uterine tube or fallopian tube. We have intramural part, we have isthmus. Isthmus is the part of uterus also, and isthmus is a part of fallopian tube also. First part is called intramural part, isthmus. Then we have ampulla, most dilated part. Then we have infundibulum, and in fundibulum we have a finger-like projection called fimbriae. Okay, let's discuss uterine, 10 centimeter long. It lies upper border of the broad ligament. See, this is the broad ligament, and upper level of broad ligament we have fallopian tube or uterine tube. And if we talk about the parts, number one is intramural part, that is 1 centimeter in length. It is shortest, narrowest part, and it acts as an anatomical sphincter, and it lies within the uterus. It lies within the uterus. Then second part is called isthmus. It is 3 centimeter in length. It is act as a physiological sphincter. It is most common site of ligation, tubal ligation, when we do permanent family planning, when the female is having 3 to 4 C-sections, and due to the mutual understanding of the husband and wife, they decided to have ligation of the fallopian tube. So isthmus, this is the most common site for tubal ligation, and this tubal ligation can be done by laparoscopy or simple by abdominal incision. Then third part is called ampulla, that is 5 centimeter in length. That is the largest, widest and most common site of fertilization. Fertilized ovum usually stay over here. Yes. Okay, if I can show you again. It is very complicated now. This is the uterus now. I'll do like this. The part which is invaginated in the uterus, that is intramural part. Then we have isthmus. Then this is most dilated part, that is called ampulla. This is the ampulla. Ampulla, it is largest and widest part and most common site for fertilization. The sperm will come into here, and from the ovary the egg will come into here. So this sperm will go into here. This is the most common site for the fertilization of the egg and sperm. And also this is the most common site for ectopic pregnancy. Normal fertilized ovum is supposed to implant at the posterior wall of the fundus. Yes. But ampulla is the most common site for ectopic pregnancy. You can see the attachment of the fertilized ovum other than the normal position, that is called ectopic pregnancy. Just like we have discussed ectopic testes also. If the testes are not present in that scrotum, or maybe present in the thigh or the perineum or somewhere else, not in the normal position, that is called ectopic testes. Same is true with the ectopic pregnancy also. If the fertilized egg is not attached in the uterus, other than the uterus, maybe in the ampulla or in the ovary or in the pelvic abdominal part or pelvic part, is called ectopic pregnancy. But most common site of ectopic pregnancy is ampulla, and least common site of ectopic pregnancy is ovary. And then last but not the least, the fourth part is infundibulum part. It is a funnel shaped part, or you can see this is the infundibulum, and it is having finger like projection called fimbriae, which will catch the egg from the ovary. And during the pelvic inflammatory disease, the first of all, the infection will go into the vagina, and through the vagina it will go through the cervix, external os, cavity, internal os, isthmus, body of the uterus. Then it will infect the fallopian tube. The inflammation of the fallopian tube is called salpingitis, and through this salpingitis may infect the peritoneum. In pelvic inflammatory disease that starts from the vagina, it will infect the peritoneum or peritonitis, that is surgical emergency. Okay, and lastly we have sterility. If the female is unable to have babies, same is true with the males. If the male is unable to have baby, that is called impotent, namardi. But in females we change the term from impotency to sterility. If the female is unable to bear or have a baby, that is called sterility. And most common cause of sterility in a female, that is called tubal blockage. If there is a blockage of this tube, maybe due to any infection or maybe due to any congenital reason. So there are the two reasons, congenital or any infection which will ligate or block, which will block this tube, or you can say tubal blockage. This is the most common cause of female sterility. And then we have hysterosalpingography, in which we are supposed to check or see, visualize the uterus and the fallopian tube. We inject a oily dye in the uterus and then we can check. And last we have posterior colpotomy or colporaphy, in which we drain the pus from the pouch of Douglas. So that was about the uterus and all these things. In a nutshell, we have discussed the internal parts also. This is the hymen, you can say covering, very important medico-legally to check the virginity of the female in females, until unless, okay, don't judge, we should not be very judgmental. The hymen may be break not only due to the intercourse, maybe during cycling, maybe during sports activity, or there are some other activities like wearing heavy weight also, cycling also, weightlifting also. So we should not be judgmental. So hymen. Then we have stratified non-catenized squamous epithelium of the vagina, and there is a presence of doderline bacilli, which will convert the glycogen into lactic acid. As we know, lactic acid is the acid. So due to the lactic acid production, the pH of the vagina is very acidic, almost 3 to 4. But the semen is very alkaline. So alkaline semen will enter into the acidic vagina, and it will provide almost 6 to 6.5 pH for the sperm to go upward, passing through the cervix, into external os, cavity, internal os, body of the uterus, then fallopian tube, and at the ampulla, most common site. Ampulla, most common site of the fertilization. Then we have discussed cervix. This is the most fixed part of the uterus, having 3 parts, external os, cavity, and internal os. Then we have talked about uterus. There are 5 parts. Number 1 is isthmus. Fallopian tube is also having isthmus, and uterus is also having isthmus. Isthmus is present between the cervix and the body. Then we have body, upper 2/3. Then we have fundus. The fundus is present just above the entry of the fallopian tube. You can say this is the entry of fallopian tube here and here. So just above the entry we have fundus. The posterior wall of the fundus is the most common site for the attachment of the fertilized egg. Then okay, we have the cornu of the uterus. Then fallopian tube, we have discussed uterine tube, 10 centimeter in length. Number 1 part is again isthmus. Then we have isthmus, or another part, fallopian tube. Number 1 part is intramural part. In this one is the intramural part. Then we have isthmus. Then we have ampulla, most wide part and most common site of the most common site for the fertilization of the ovum. The sperm will come through vagina, cervix, uterus to the ampulla, and ovum will start from the obviously the produced by the ovary, catch by the fimbria and enter into the ampulla. And ampulla is also most common site for the ectopic pregnancy also. Then we have infundibulum. Infundibulum also a funnel shaped part is also called fimbrial part. It is having finger like projections. Okay, if I can show you here, this is the ovary. This one is the ovary, right? This one is ovary, and here we have finger-like projections, which are used to cover all the ovaries. These are the finger-like projections, part of the infundibulum. So whenever there is a production of the ovary, production of the ovum or egg by the ovary, the fimbriae will catch this egg and being engulfed and enter into the infundibulum, then enter into the ampulla. So ampulla, this is the site where the ovum will come and try to fertilize with the sperm. So that was, and this is the external genitalia. We have discussed these things in detail. Is there any question from anyone?
No, sir.
Is it really clear?
Yes, sir.
Okay, thank you so much.